part of doing the balance now is to first of all make sure you're getting the correct kind of ultraviolet. For example, the ultraviolet that is in the sunlight is very broad, but only a very tiny fraction of that is therapeutic for the psoriasis. So if you get phototherapy delivered in what's called, for example, narrowband booth, you eliminate most of the ultraviolet. You get a very small dose of ultraviolet. So we think, first of all, that's safer. The second issue with that, though, is there are now other treatments for skin cancer which are not ultraviolet based. There are now some new so-called biologic drugs, which are shots, and there are other things down the road. So there's some newer approaches for that. We know that the risk for developing melanoma is increased in psoriasis patients who have received that treatment, and that's, again, these follow-up studies from Harvard. So it's a very individualized thing, but I would say the most important thing is to, if you need the ultraviolet light to control your disease, make sure you're getting the correct kind of ultraviolet light. Not every doctor's light booths are equal, and certainly environmental light is really, you know, when we didn't have anything else, that was okay. And if you could go to the Dead Sea for a couple of weeks and your insurance would pay for it, that would probably also be okay. Because actually at the Dead Sea, because it's so, because it's so low down, the